His doctor had his blood pressure exactly where it needed to be, stable for 2 years, on two medications, working perfectly. Then, one winter, his knees got worse. The arthritis had been building for years, but this season it became difficult to walk to the end of his driveway. He went to the pharmacy. He picked up a bottle of ibuprofen, the same one he had used for years, over the counter. No prescription needed. 6 weeks later, his blood pressure was dangerously elevated. His doctor was confused. His medications hadn't changed. His diet hadn't changed. His stress level hadn't changed. Then came the question nobody had thought to ask. What pain medication are you taking for your knees? If you are over 60 and you take any medication for blood pressure, your heart, your thyroid, or your cholesterol, there is a warning your pharmacist should have given you that you almost certainly never received. Not because your pharmacist was careless, but because this warning falls through the cracks of how we deliver healthcare to seniors in this country. Every single day. Today, I am going to show you what that warning is, why the system fails to deliver it, and the one habit that protects you even when the system doesn't. Here is something most seniors on multiple medications were never told. When your doctor prescribes a medication, they are managing the condition in front of them. They see your blood pressure. They prescribe for blood pressure. When you walk into a pharmacy for an over-the-counter pain reliever, no one cross-references it against your full prescription list. There is no automatic check, no alert, no conversation. You pay, you leave, you take both. The interaction happens in your body. And the first sign of it, elevated blood pressure, fatigue, reduced kidney function, looks like something else entirely. Your doctor adjusts your blood pressure medication dose, and the real cause, the ibuprofen on your kitchen counter, is never identified. The most dangerous and most common unworn interaction in senior health has a name that medical professionals actually use. It is called the triple whammy. Here is how it works. Many seniors with high blood pressure take two types of medication simultaneously. An ACE inhibitor, or ARB, the pril and sartan family we covered earlier in this series, and a diuretic, a water pill. Together, these two medications work well. They lower blood pressure through complementary mechanisms, and your kidneys adapt to manage both. Now, add ibuprofen for joint pain. Ibuprofen and all NSAIDs, including naproxen and aspirin in higher doses, blocks prostaglandins. Prostaglandins are compounds your kidneys rely on to maintain blood flow. When you block prostaglandins with an NSAID, your kidneys lose one of their key pressure regulators. The ACE inhibitor, or ARB, removes a second compensatory mechanism. The diuretic reduces fluid volume, removing a third. Your kidneys are now trying to do their job with all three safety systems offline. A large case control study published in the British Medical Journal followed nearly 500,000 patients over 6 years and found that the combination of a diuretic, an ACE inhibitor or ARB, and an NSAID significantly increased the risk of acute kidney injury. Not acute discomfort, acute kidney injury. A condition where the kidneys lose their ability to filter the blood properly, a serious, potentially life-threatening event that can develop within days of starting the combination. I want to stop here and be direct with you. This is for educational purposes only. If you take blood pressure medication, especially an ACE inhibitor, an ARB or a diuretic, and you use ibuprofen or naproxen for pain, please bring both medication bottles to your next doctor or pharmacist appointment and ask specifically about this combination. Do not stop either medication without medical guidance. but do have that conversation. Because what I am about to give you is not just the problem, it is the solution, and there are excellent pain relief alternatives that do not carry this interaction. The safest over the counter pain reliever for seniors on blood pressure medication is one most people already have in their medicine cabinet: acetaminophen, sold as Tylenol. Acetaminophen does not block prostaglandins. It does not interfere with kidney blood flow. It does not blunt the effectiveness of ACE inhibitors, ARBs, or diuretics. For general pain, arthritis pain, and headaches, acetaminophen is the recommended first choice for seniors on multiple blood pressure medications. The critical rule: stay within the recommended dose. For adults over 60, that is no more than 3 grams per day and lower if you drink alcohol regularly or have any liver concerns. Always check with your doctor for the right amount for your specific situation. For topical pain relief, joint pain, knee pain, localized arthritis, diclofenac gel, and NSAID applied directly to the skin has significantly lower systemic absorption than oral NSAIDs and is generally considered a safer option for seniors with cardiovascular concerns. Ask your doctor if it is appropriate for you. Here is the single habit that protects you from the warning you never received. Every time you pick up a new medication prescription or over the counter, bring your full medication list to the pharmacist and ask one question: does this interact with anything I already take? That question takes 30 seconds. The answer can take 30 seconds, and what it catches can prevent weeks of unexplained symptoms, unnecessary dose increases, and in serious cases, hospital admissions. Your pharmacist has your complete prescription record on file. They are trained specifically in drug interactions, and under current pharmacy practice standards, they are required to counsel you on significant interactions when asked. That one question is the most underused protection available to every senior on multiple medications, and it costs nothing. Let me show you exactly how wide the gap is between the warnings seniors should receive and the warnings they actually get. According to a 2024 analysis published in the Journal of the American Medical Association, more than 4 in 10 adults aged 65 and older take 5 or more prescription medications every day. Roughly 30% of older adults, nearly 1 in 3, take 8 or more prescription medications daily. That is before you count over-the-counter medications, vitamins, and dietary supplements. And research reviewing potential drug-drug interactions in older adults found that somewhere between 80 and 90% of elderly patients had at least one potential drug interaction in their medication regimen. 80 to 90%. And the vast majority of them were never warned. This series has now covered 6 of those interactions: grapefruit and statins, potassium-based salt substitutes and ACE inhibitors, vitamin K and warfarin, protein timing and muscle protection, coffee, milk, and thyroid medication, and now ibuprofen and blood pressure medication. Every single one is clinically documented. Every single one appears in prescribing guidelines. Every single one has the potential to make your medication meaningfully less effective or meaningfully more dangerous. And in survey after survey, most seniors report never having been specifically warned about any of them. This is not a failure of medicine. It is a failure of time. The 11-minute appointment cannot carry the weight of everything a 68-year-old person on 6 medications needs to know. But you can know it. You can ask for it. And now, at least in part, you have it. Here is the one sentence that matters most from this video. Ibuprofen and other NSAIDs can significantly reduce the effectiveness of blood pressure medications and, when combined with ACE inhibitors or ARBs and diuretics, can create a triple whammy effect that places serious stress on the kidneys, and most seniors on these medications are never warned. The protection is simple. Use acetaminophen instead of ibuprofen when you need pain relief and you are on blood pressure medication. Ask your pharmacist about every new medication before you take it, and bring your full medication list to every appointment. You are not supposed to know everything your doctor knows, but you are supposed to have been told the things that affect you directly. If you weren't, that is the gap this channel exists to close. If this series has helped you, subscribe. Every week I bring you one thing your doctor didn't have time to explain, and it is always something you can actually do something about. Before you go, 6 videos, 6 interactions, 6 things most seniors never heard. Next week, I am changing direction completely. No more warnings about what your food is doing to your medication. Next week, I want to show you 5 foods that research now links to meaningfully reduced cognitive decline in adults over 60. Not supplements, not expensive protocols, actual foods, affordable, available at any grocery store this weekend. And one of them, the one with the most consistent evidence across the largest number of long-term studies, is something most seniors eat less than once a week. Most people think protecting their brain after 60 means cutting things out. Next week, I am going to show you it is mostly about adding one thing in. That is next week. Don't miss it.